Gracias, Maribel. Good afternoon, everyone. It seems like I have been in this chair for the entire day today. It has been a day of a lot of rewards and a lot of blessings. And I thank you all for choosing to be with us this afternoon. Especially for many of you, this may have been a very busy day. And so thank you for choosing to be with us and to spend this time together. Our presentation today is going to be focused on this program that we created to support people that have been impacted by the pandemics, and meaning the COVID-19, the wildfires, and also social injustice pandemics. And so we will be talking about that. But before we get to that, I like always to set the intention of recognizing the beauty, the miraculous that it is to be together. And also right now, I want us to take a moment just to take a deep breath, ground us, and also be grateful for this opportunity. And at the same time, recognize that during the last year, there has been a lot of suffering within our communities, and especially the Latinx community. Our Latino community has been suffering significantly. But at the same time, I want us to take a moment to take a deep breath and also recognize the aspect of healing and resiliency and fortaleza and strength and sabiduría, wisdom that our community has and continue having, and that during this difficult time has showing us the beauty of that. I also want to honor and take a moment to honor the losses that we all have experienced in different capacity, in different ways. And also, I hope that throughout the midst of the difficulties and the circumstances that these pandemics have caused on you, on your community, on your loved ones, you also can find moments of blessings, moments of joy, and also the power of healing that happens within communities, and the power of healing that can happen as we work work together through this time. So let us honor that, and let us start actually introducing ourselves. So I would like to ask Natalia, one of my colleagues and students that is here. She can introduce herself. Then I pass the microphone to Claire, and then I will finally introduce myself.
Hello, my name is Natalia. I'm a Puerto Riqueña. And it's a pleasure to be here, especially promoting being able to show everyone a work that we're doing, because our community definitely needs it. And I'm so happy to be able to pass this along, and hopefully people can gain things out of this. Thank you for having us here.
Hi everyone, my name is Claire. I also work with Dr. Zúñiga. I'm a third-year doctoral student at Pacific. A part of the Sabiduría emphasis that we have there, working specifically with the Latinx and other underserved communities. And as Natalia said, this program has been a really big part of that, and we're really excited to share with you all today. So thank you for having us.
Thank you. And my name is Ruth Zúñiga. I am originally from Costa Rica, an immigrant mother, faculty member at Pacific University, and honored to be the director of this program that is called Sabiduría, Latinx Psychology Program. And if you have been joining me through different sessions that I have in this conference, one of the things that you're gonna see is that all of the different programs that we have interplay, and they relate to in one way or another one. Earlier today, like an hour and a half ago, we were presenting about promotores de salud and psychologists, and actually that program, thanks to that program, now we have this recovery of psychology program. Early in the morning, we were presenting about outreach, and thanks to that outreach, we have the collaboration with promotores. So all our programs are interconnected, and in some ways or capacity, that's what has helped us grow in different ways. So I ask you and I recommend you to go and check the PowerPoint for details as we're going through this very quickly. I'm not going to go through the learning objectives, but pretty much the idea is that we want today to discuss this program, but also hopefully for you to take some ideas about similar programs that you can build in your settings and your communities, wherever it is that you are working or practicing. Before we start, as I mentioned it before, we are part of Sabiduría, this program in Pacific University. Pacific University is a predominantly white institution in the Northwest in Oregon. And it's important for you to know who we are, because this is the program that connects all these little programs that we have been talking about it throughout these couple of days of presentations. We are one of 10 in the nation that focus on training master level and doctoral level psychologists to work with the Latinx community in a way that is culturally and linguistically informed. And students are trained not only academically and research, but one component is their clinical practice. And their first clinical experience for doctoral level students, which usually happens in their second year of their program, is to provide services in what we call the Pacific Psychology and Comprehensive Health Clinic. This clinic is a training clinic. Currently, we have about 76 students practicing, and about those 10 to 12 students are bilingual, bicultural many, and many part of Sabiduría. And because we are a training clinic, we have the opportunity to provide services at low cost. We also take Medicaid Medicaid insurance, but most our services are low cost. And I want you to think about it, that it is within this context, within the academia, Sabiduría, and within our training clinic that our program evolves. So I'm not going to talk much about this, because this has been one of the topics of this conference, how the COVID-19, the pandemic, and the wildfires have significantly and disproportionately affected Latinx individuals, but especially migrant health workers. And we know the multiple ways that they have been disproportionately affected. And I think that if we ask you about your experiences in regards to this topic, many of you will share many of the things in this slide here. So, but also we have noticed that in addition to the health, physical health, the economic difficulties, the housing challenges, the food insecurity, there has been this pandemic have actually increased the sense of isolation within our migrant communities, the inability to connect with families, the economic stressors, the losses, and the grief and pain has been very similar to any other disasters, and even compared to what we look like we would look like a civil wars, or being in areas where a war and very heavy violence exists. And therefore, these senses of isolation, these emotional distressors, in addition to the issues that already exist within our communities in regards to stigma and racism, and in regards to lack of mental health access, create an extra challenge for the emotional health, the mental health needs of migrant farm workers. We can call, again, the pandemics are very similar in many ways, and we can actually check a specific trauma that individual experience. Any trauma, you can actually look at it, and the pandemic and the experiences of the pandemic, and they're very similar in the body. The effects in the body, the effects in the mind, the effects in the spirit are very similar. And that is because the sense of uncertainty, the aspects of unpredictability, the losses, the loss of connection, the loss of feeling like we are not having a sense of control, and the challenges and the difficulties continue. So we have noticed, we have been aware of the challenges of our communities in regards to emotional and mental health. And we have been providing services, mental health services in our clinics for several years for Spanish-speaking individuals, low acculturated individuals, immigrants, migrant farm workers. But the difference is before the pandemic, people have to come to us. We went to do outreach, we provided brief psychoeducation, but for those very difficult mental health concerns, the people have to come to us. And that's not as simple thing for a migrant farm worker. So the pandemic, on the other hand, allowed us something that we were not be able to do before, which was provide mental health services through telehealth. But when we were thinking about the mental health services that we could provide, we could not just go with traditional mental health services. We need to focus on mental health services that was focused on disaster-related work. Also, mental health services that for migrant farm workers was focused in simple and easy and no long-term treatment. And we were able to come up with a program focused on using the psychology of recovery, which Natalia is going to share right now a little bit what that is, and then we can talk about how that we implemented that psychology of recovery within this program. And I will start sharing for you, Natalia. Oops. Just one second. Go ahead.
So beginning our program, our focus was to get the basics, the immediacy. What did our community need right directly at the aftermath, and how we would be able to provide that. And so restoring access to basic needs was one of the first things on our radar to work with our clients and to figure out what is needed. Don't have food, access to water? Do they have access to housing? Do they have somewhere they can go? If not, what are the places that we can help connect them to? And also, after going through a fire, there's the sense of not being safe, especially how the body reacts to being in immediate danger and the after effects of that, the stress, just everything just happening at once. And so to instill a little bit of sense of safety and kind of return that sense of calm as well. It won't be perfect, especially after direct aftermath, but trying to get them from here back lower. And brief and present focused to reduce and prevent those long-term distress, because especially when you experience a traumatic event, especially one of that caliber, these effects not only happen now, but it can also have long-term effects as well in the mental, physical, emotional, relational health as well. And so we're looking at all of those aspects to try and prevent it from turning into a long-term difficulty. You can go to the next slide, please. All right. So part of our, after we do the interview in the first session, part of it is also skills-based training. So what can we do immediately to help the person regulate their body and help regulate their mind to get a sense of calm? So our intake is the information gathering phase. So we kind of gather what was it like before the event happened? What is it like now? And also, what kind of things did the individual do to get over and be able to manage other different events or different struggles that they've done? So we try to look what has worked for you in the past and how can we use those strengths now to try and help move forward. Building problem-solving skills, being able to look at it from different angles, promoting positive activities to help someone recover. So we're not just looking at what happened and what are the struggles that you're going with now. We're also looking at what kind of strengths do you also have, or what kind of positives that you do have as well. So we kind of balance that out. We want to honor the struggles, but we also want to honor what is going good in the person's life. Managing reactions. Stress reactions sometimes is immediate, irritability, fear, and sometimes taking a step back and being able to recognize those reactions and being able to process them can help. Specifically dealing with the emotions. This is a brief skill-focused thing, so we're not going deeply into the trauma. This is to try and build just short-term skills to help just build the building block to be able to move forward. You can, yep. And so what we offer is a contact and engagement, not only with a Spanish-speaking counselor, but also all of the different resources that we provide, connecting to the community, connecting to areas that do speak Spanish, and what kind of availability support there is, financial, housing, etc. So connectivity is a big point. Like I said before, safety and comfort, trying to stabilize both physical situation, what kind of relationships that they have available, practical assistance, and of course the information gathering, and information on coping, which is we're going to be practicing a little later on in the presentation, breathing skill, which is one of the many skills that we help our clients with, because the breath is especially a really good way of regulating the body, forcing the body to regulate. And linkage with collaborative services. All right. And a lot of these services that are done before the rapid response have been done with mainly white Caucasian individuals. And so culturally adapting this to fit within the Latino community has been one of the big goals of our RRT services. And so Diaz Conde, Perez Ramirez, and Villasencio Colon came up with this article that talked about how to culturally adapt it for the Latino community, using cultural sensitivity, including information in Spanish and English. And cultural sensitivity is much more than just language. There are a lot of cultural factors going on that we also have to take into consideration, not only when we're talking with the individual, but also what resources and ways of coping that might be a strength to our community. And also the flexibility and unstructured work. A lot of psychology work is structured in terms of how a session might go, what's appropriate ways to go about it. But to be culturally sensitive, sometimes you have to talk a lot more with the client about their experiences or about their families, or just the normal chatting in order to get more to know the client, which is definitely a huge thing with the Latino community in order to build that trust. Assess acculturation, how acculturated they are to the American culture, how to navigate the systems on the internet. Sometimes we have to help them navigate the internet, especially if it's not in Spanish, and just kind of figuring out where they're at. Our assistance is not just skills building, it's a lot more to try to help that immediate relief. Let them tell their own stories and experiences. Let them find their voice. One of the big things about working against trauma is taking away that voice from the person is a big thing that causes a lot of distress and a lot of fear. So helping them just find their voice can be incredibly powerful, and something that we definitely focus on in our services.
Thank you, Natalia.
Mm-hmm.
So, as Natalia was mentioning, this is the basic of our program is focused on psychology of recovery and rapid response mental health treatment options. However, very few has been done in regards to this kind of work with Latinx individuals. The mentioning of the Diaz Conde and the other researcher, they were doing this work in the Puerto Rican community after the aftermaths of Maria, and so the Hurricane Maria. So in this case, we have a good template that we could use, and we didn't have to go and build from zero. However, we also have to understand that the community in the Northwest, the community in Oregon that we work with, the migrant and seasonal migrant farm worker community, is very different than the Puerto Rican community. So we have a good template, but we needed to build upon that template. And the other thing is, we also needed to first figure out how we're gonna go and do this and what resources are we gonna invest. So we actually closed in Oregon. The state was closed because of the pandemic, I think on the 13th or 11th of March. And by the end of April, we have been able to secure some funding. At that moment, I think the organizations were a little bit overwhelmed by what this means, and we were able to partner with one organization. And it was thanks to the work and the advocacy of Promotores de Salud. Remember, I was saying that we are all connected in different ways. The Promotores de Salud saying this is going to be super important. We were able to just find the funding, find the resources to get for the sessions for the people to be free. That was our funding. The idea wasn't to pay for the providers. That's the beauty of working with the students, that the students need hours. And so they need hours for this work. And so that's free service right there. Sorry, Natalia and Claire. Also the aspect in academia, usually faculty members have portions of their work to what is called service. So being a licensed psychologist helps that, my services doesn't have to be paid for this. And instead, the little funding that we could secure was to make sure that these services were appropriate, free of charge for our community. So the first thing that we did was look for collaborators with the Promotores de Salud to give us some guidance, with a collaborator, Providence Health System, to find the fundings, and actually and then trying to build the curriculum, how this curriculum will look like from a culturally informed place, not only linguistically, but with all the challenges that telehealth brings for our communities. And so by June 2020, we were able to start providing the mental health services to the Latinos affected by COVID. And by September, we negotiate with our grantor to allow us to move these services to those affected by the wildfires. And so because of that collaboration with different organizations, we were able to get a little bit of fun. But most important, what we need is the word out, that the collaborators, that our community knows that we exist and that we are providing these services. Because just providing these services and making it available doesn't mean that the community is going to use it. We needed our collaborators, and especially community health workers, promotores de salud, to help us with the promotion and also the navigation for people to access our service. We have new partners, and actually we offer our first in-person outreach activities a couple of weeks ago when we were to the Southern Oregon, where people were affected by wildfires. So we were able to offer some of these psychology of recovery skills and recruit people, also participants or patients, to continue their 4 or 5 sessions within online with us. And so what a couple of things, how it looks like with us. It means, again, I was mentioning psychology students are the ones that doctoral level students, the ones that provide these services. In Spanish, we have to culturally adapt many things, like the navigation service, especially. We have to make them very different, just because people usually don't just call a phone number and say, hey, I want to receive these services. They don't even know what rapid response services are. So we needed to adapt that. Again, we have to work very closely with our community. And then also another thing that we actually recognize is that many of our community members, just now, the issues of COVID or the wildfires are just at the tip of their experiences. It is through these difficulties that their traumas start showing off, their past traumas, their past experiences, their experiences with intimate partner violence. So therefore, we only can offer 5 sessions, which is what rapid response are. And then after that, we support them with longer term treatment because these people may need longer term treatments. The sessions consist of 5 sessions, as Natalia was saying. There is a little bit of a screening, there is a little bit of information gathering, but all the other sessions are focusing on a skills-based, teaching them the skills for self-regulation, but also accessing resources. And with the community, a lot is about that, accessing basic need resources. And also, we like to call it, the community. In other rapid response treatment programs, they say, it's more about the skills, less about what people talk, because you don't want to open the kind of the trauma experiences. But with our community, it's almost impossible not to do that. And so what we like to do is we like to engage in testimonial and desahogo. And people say desahogo in English is venting, but actually it's not. Venting is just, desahogo for us is a little bit more. If you actually look at the word is on drown. So we need that desahogo in the moments where we are drowning or feeling like we are drowning, being able to just that testimonial, say that, share about your experiences is one way to continue being able to swim and being able to survive. So we created a format, we created the forms, we adapted the curriculum, and we always like to do things in this way so it can be replicable with other communities, or that we can share with other people if people are interested. So again, we try to engage in some of the psychological recovery or recovery recommendations, but we also have to focus a lot on culturally appropriate skills and trying to focus on that. And a lot of that is rebuilding community and helping the individuals connect with their communities. And so I think one of the things that we do through teach the clients or work with the clients is through activities of self-regulation, and there are many to choose with. Many of the mindfulness activities tend to be at times difficult for people to follow, so we try to make it accessible and easy. And in this moment, Natalia is going to guide us through one of those activities that we do in the sessions.
All right, so you'll want to join me. If you're sitting, find a comfortable spot to sit with feet flat on the ground. I'm going to take one hand and put it on your chest, and take the other hand and put it on your stomach. I'm going to do some diaphragmatic breathing. So I'm going to try to breathe in through the stomach, deep and long, and then exhaling. I'm going to exhale a little bit through the lips. So inhale, filling up your stomach. And exhale slowly through the lips. Inhale slowly through the nose. And exhale slowly through the lips. Inhale slowly through the nose. And exhale slowly through the lips. Again. Two more times. Once more. And go ahead and open your eyes. Come back. And the breath is a powerful thing. You have your breath with you no matter where you go. So if you're able to take a moment and just take these deep breaths, making sure to fill up your stomach, because there's some good hormones there that can help circulate throughout your body and help relaxing.
And thank you, Natalia. And one of the things that we try to do this breath work and many breath work in any activities that we could do in the community, not only in the therapeutic room, but also in our charlas and different, and even when we go to recruit people to attend our RT sessions, we show them, this is not about therapy in the way that you think about it. Some of the things that we're going to do is about breathing. And then we talk about what are the reasons, the importance. We actually may show them how, and maybe for many of you, you notice that the hand that was raising up was the one in your chest versus the one in your stomach. And so we will explain that the reasons why we want the stomach hand to be the one raising up. And the other thing that is important is that we tell our patients is that you don't learn to swim while you are drowning. You learn to swim to make sure that you don't drown. So learning breath work, being able to focus on your breath every day is one way that you can engage in this way of self-care and self-practice. Because one of the things that we have noticed is that sometimes patients come to us very dysregulated, as we like to call, very overwhelmed. Other times, they when they come to us, they're already feeling better. And now it's like, why I'm gonna sharing much of this or why I'm doing this. And actually that's when we want them to encourage doing this, that trying to focus on learning in moments when you are not too overwhelmed is what we want. And so I would like to, for Claire now is gonna share with us what has been some of our experiences, a little bit numbers, output numbers in regards of this service that we have provided.
Thank you, Dr. Zúñiga. So in total, thus far, we started the program at the beginning of last year, started developing it in the summer and really started seeing clients in the fall. And we've provided a total of 43 services, including seeing clients, doing sessions, doing outreach events and community coordination, approximately 26 hours and some actually doing face-to-face time or phone-to-phone time with clients, and usually an average of about 40 minutes per session. Some of the reported stressors, main concerns that people have experienced are, of course, mental health difficulties, depression, anxiety, stressors, financial difficulties that have come with the pandemic and job loss, housing loss through the wildfires, family conflict, relational conflict, marginalization and discrimination, which was already there and has really just been exacerbated due to the social climate of the past couple years and the last year especially, and a lot of grief and loss. As we know, the COVID-19 pandemic has disproportionately affected the Latinx community and wildfires as well, because a lot of our community members live out in rural areas where the wildfires have been the most destructive. Approximately 82 of the patients that we have seen thus far have reported experiencing adverse childhood events or experiences, otherwise known as the ACEs. So these include things like abuse and neglect, witnessing community or domestic violence in the home, having parents who are separated or divorced, witnessing or experiencing suicidal ideation, substance use, things like that. And more than 75% of patients have also reported experiencing emotional and additional mental health difficulties. As I mentioned, a lot of depression, just feeling low energy, really fatigued, not able to concentrate on daily activities, and a lot of anxiety about what the future is going to hold, a lot of uncertainty based on the past year. None of us have really known what's going to come out of this pandemic, and I think we're still fighting a lot of that uncertainty in our day-to-day lives. Along with the financial stressors, along with additional mental health stressors, there's just so much uncertainty, and that's really been affecting a lot of our patients.
And I would like to add something to that has been very interesting for us, is that we gather this data even with our patients, even when it's not research, but it helps us understand quite a bit of what is going on with our Latinx community. Just the fact that before the pandemic, 82% of the people that we see experiences ACEs, and that 75% already receive or were already struggling with a mental health concern. It is overwhelming. And on the other hand, it has shown us that maybe this rapid response treatment is one way that the community are recognizing this is the time to seek out help. I have these adverse childhood experiences, I have these mental health concerns, but I have not been able to get that service or to seek out services. But now with the pandemics, now people are engaging in mental health support.
So here's just a couple more of our preliminary findings. In terms of the clients that we've served, it's been about 85% female, 14% male, majority between the ages of 45 and 54, and majority Hispanic or Latino. And some of the main concerns that you can see in the graph here: healthcare barriers, economic barriers, educational, economic, and nutritional barriers, which Natalia and Dr. Zúñiga already talked about. Okay, next one. So now we want to share some challenges and rewards of being a part of this team, kind of from our student and clinician perspective. So starting with some of the challenges, access to technology has been really difficult for some clients. This has been a completely telehealth-based service. And so we connect to all clients either via our HIPAA-protected Zoom on the screen on the computer, or our HIPAA-protected Zoom phone account, so we can call people if they don't have internet access. But that has been really challenging because you need internet access to access the video, and or you need a phone or phone connection to access services via your cell or via phone. And if people are kind of in and out of service areas or don't have a good connection, it can be really hard to connect with people and stay connected with people. RRT isn't appropriate for all clients, especially more high-risk clients if they have really imminent suicidal ideation or they're really struggling with substance use, for example. They need a higher level of care that we just can't provide in the 5 sessions that RRT offers, so it's not appropriate for everyone. Because it's a short-term service, the therapeutic alliance can be hard to build. It often takes at least 5 sessions to kind of build a relationship with somebody where they feel like they can trust you and open up to you. And we only have that amount of time. And especially with so many of the previous traumas that Dr. Zúñiga was speaking about earlier that many of our clients have experienced, and a lot of other traumatic experience that they've had with health providers in the past, building that alliance in a short amount of time can be difficult. Recruitment and promotion, we're not doing any in-person recruiting right now, so we've been really leaning on our community partners such as the promotores de salud to help us get the word out about this program. Always the structural and systemic barriers, having people access care. As Dr. Zúñiga said, there's not just a line that you can call to say, hey, I want these services. And so navigating the different systems and really finding ways to reach the community and have them be able to reach us has been something we've been continuously navigating. And then many people who could really benefit from our RRT services may not think that mental health is a priority. And I know that Diana had a question about that earlier, so we will talk about that at the end.
Thank you. And I want to add in regards to this has been one of the other very interesting factors that we provide these services for free of cost to the patients. We have navigated the system, many of the issues to remove the barriers, and still we are underutilized. Like our mental health treatment, we also offer mental health treatment in our clinic, a regular treatment. We have a waiting list of 30 people as an example. And then we have a space in our RRT. And when we ask the people why then they don't using RRT, and that usually the community says, because I'm not affected by COVID, or I'm not affected by the wildfires, thinking that being affected by the COVID or wildfire is if you have COVID, or if you have some individuals now are accessing the resources, RRT services, if they lost somebody, because maybe they're experiencing grief and loss. But getting, this is where the promotores work becomes so helpful, because they say, we all have been affected by COVID. We all could access this service. The only difference is that long-term treatment will be different because it's more about the long-term effect issues. This one is more about the skills base and just to help you navigate with the difficulties. Maybe the difficulties maybe that you lost your job. Maybe the difficulties is that you're feeling anxious, that you're having your children at home and not being able to help them. All of that is being affected by COVID. So getting for the community to understand emotional health versus mental health in this context has been a little bit challenging. Claire, back to you. Sorry about that.
No, that's okay. And then more importantly, all of the rewards, which couldn't fit on one slide, but we narrowed it down to the ones that we thought were most important. RRT is wonderful. It's been a great experience. It's highly satisfying. A lot of clients do find that immediate relief, like doing, for example, that deep breathing exercise that Natalia led us through. You know, we can do that our very first meeting with somebody, and that can be just an instant sense of tranquilidad, like just this instant relief for people that can be really helpful. It is brief and skills focused. And so we have a short amount of sessions, but we really do provide a lot of skills in those sessions. And so I think people find that really beneficial as well, that they're getting a lot in a short amount of time. It's very pragmatic for any of you in the audience who are clinicians or have other jobs that require a lot of paperwork. RRT is great because our notes are very short, they're concise. It usually takes me about 5 to 10 minutes to do a note after a session. And so it makes the documentation process quick and easy. As Dr. Zúñiga was talking about, it's a free service during a much needed time. So many of our patients would not be able to access mental health services if this was not free. Even sliding scale services are really not attainable for people right now. And so that has been huge in order to get more clients involved. The ability to provide a service in Spanish. I think our entire team is bilingual. And so that is another way that we can connect with the community that people who maybe wouldn't normally come to see a therapist or want to engage in mental health. There are so many barriers, and a huge barrier is language, right? If they have to have an interpreter in the room, or if they just don't feel connected to the clinician because of the language, being able to provide services in Spanish has been awesome. It is a evidence-based treatment, the Skills for Psychological Recovery. There have been quite a few studies on the Skills for Psychological Recovery. And so it's credible and trustworthy. And then again, the support from our community partners, specifically promotores de salud, we wouldn't have been able to do it without them. And that has really helped us reach so many people that we normally wouldn't have been able to. So that has been awesome, being able to work with them to really get the community involved in this program.
Thank you, Claire. And I just want to add also that in regards to credibility and trustworthiness, we actually have been doing this different work, our outreach in our community for many years now. And so when we came with this, we came and created this program. It's not like we were starting from zero in relationship to working with the community, because the community already knew of us and have been working with us. And the other thing that the program has been able to expand services beyond our metro area, thanks to the telehealth services. So what has been some of the lessons that we have learned is being able partnership, collaboration with other organizations, and also in the creation or adaptation of what exists out there, like the Skills for Psychological Recovery. There is even a guide that we will provide that information in the PowerPoint. You can see the information about that. But just going with that guide without the context of your community will not be culturally appropriate or community appropriate. So being able to adapt it to your community by and based on the information from the community is very important. The other thing is, other important things that we recommend is that what Claire was talking about in regards to pragmatic, the notes, we decided to spend quite a bit of time ahead to create all the paperwork, to create all the ways that we were going to deliver this program, recruit students, recruit participants, recruit people from the community, and also evaluate it. So our original plan was to start in maybe at the beginning of May, but we decided to take a little bit longer. So we put all the systems in place. So when it came to time to deliver, we only have to focus on deliver the service. Also, another thing that we have learned throughout the process is how patient and creative we have to be in able to recognize and help the community deal with the multiple barriers in regards to mental health. And what I mean in regards to this, for example, we actually have to do something that people will consider unethical and appropriate, that it is that community members or community partners call us personally and say, Claire, we have the name of this person that want the need rapid response treatment, but they don't feel comfortable to leave a voicemail in the voicemail area. So now we actually go after and talk with this person, and somebody will say, but that could actually be soliciting. But if we don't do that, then that person don't seek out services. We find our ways to make sure that when we call that person, we talk about who was the one that gave us the name, if they're okay to talk with us. And then actually what we are doing here, we don't know if that person is going to become a patient of ours. What we know is that we're just talking about these potential services that is going to benefit them. And another thing that has been at times difficult is to keep motivated. The clients, Latinx individuals may be suspicious of phone interactions, and now in the way that we may call them through the Zoom call, the HIPAA protected Zoom is a block number. And so they may not respond to that. Also, within the Latinx community, we are very familiar with these soft refusals, that they may not answer the phone, or they may say, yes, they're going to attend the session and they don't show up. And you call them and they say, yes, next time, but they never say no. But you can see and understand those soft refusals. And those are the nice things about our clinicians, that our clinicians have been able to train and be able to engage in this and to engage in culturally appropriate practices in this way. So I know we have only a few minute break. So I will say we can start with questions, and we have some discussion questions, but I feel like answering the questions from the chat will be better. So Maribel, I know that we have some questions there that you can help us.
Claro. Yes, and I would like to invite all of our colegas to turn their cameras on, and then Diana, Claire, Wally, and Armando also put in some great questions in the chat. So if any of you all or any other colegas wants to just unmute yourself and ask the question, yep, go for it, and I can read the other ones.
Can you hear me?
Yeah.
Thank you for your presentation and for your work. I think it's just remarkable, and we always need more for those tools for our clients. And I see that, as you mentioned, the statistics show like the engagement for male is less than for females, and also the stigma, like we grow up thinking that maybe mental health is not as neat as if you break your leg or something like that. And I feel like it's changing because of how we're living in these days and things like that. But I think that we still need to do more effort to change the narrative. And I just feel like how can we frame it different from, no, you're not crazy, it's not, you don't have a mental illness, or you need to do these techniques, or you need to rest, or you need to do self-care, or also just think about that internal part. I think that we live in a daily life that is just hard to stop and think in those things, because again, it's just work, or all the things that we need to do, and I think it's just to create that message of how we need to stop, or you need to think about your health. I was just thinking.
Gracias.
Thank you so much for your question, Diana. Yeah, and we do that in multiple ways and try to reframing. also put it as a mind-body connection as well. And I love the example of a water, just a water cup. Stress, you're filling up the water. You're filling up the water every time you go stress, every time something happens. And you need to empty that water glass or else it'll overflow. So the idea is that especially in RRT, that we teach skills, like we talked about breathing. We also connect to resources. Like, it's not just about mental health. It's not that you're local. There's much more. There's like skills like help to relationships and just a lot more to therapy than just the stigma.
And one of the things that I want to add to that is that we try to reframe our word. Now we use mental health word here in this setting, but in our community we usually call it emotional health and wellness, and that has changed the connotation. Salud emocional salud y bienestar emocional. That sounds very different than mental health or salud mental, and that has been an important component. The other thing is that we are talking about mental health, emotional health and wellness, not only in this context, but in our outreach services with the promotores, in the promotores program, constantly talking about it. We have some charlas via Facebook. We have a lot of outreach activities where we are talking about these concepts in different ways. We actually have seen, with the RRT not as much, but we have seen an increase of mental health seeking among men in our general clinic. And I think it's just because with the pandemic, men have been able to have now an excuse, just to call it like that, which is not an excuse, to say, I can go and seek out services and support. And the more we talk about emotional health in our communities, the more we can reclaim it. As in the same way that you get physical health, we can actually mental health. The word mental health is about being in balance, being able to be, it's not about being free of illness. It's just more about the wellness aspect of it. So thank you. Now I know we have a couple of more questions.
Sí. There was a couple of questions around our diferentes comunidades. So one came in from our colega Wally. Are there significant differences in suicide prevention services between the Latinx community and the non-Latinx or non-Hispanic community? And then there's also one that kind of asks between like men seeking services and just asking if there's more research that explores alternative clinical methods there.
So a couple of things in regards to suicide prevention, just very quickly. Maybe we have one day, one charla, one presentation about this. Many of you may be familiar in regards to this, but Latina youth are the one community with the greatest suicidal attempts in the US. So the greater risk in regards to suicide because of the attempts are Latina youth. And one of the most important ways to buffer or to support youth and every individual, any Latino, but especially youth, one of the ways to prevent and to find support is the connection with culture. Connection to culture, what we call cultural collective self-esteem, being able to be connected with your roots is one of the most important protective factors. There are many, many other things, but very important to focus on those aspects of connecting with your roots, and especially for second generation or third generation individuals. In regards to men, what has been one of the things, seeing other men talking about it, modeling, hearing other people having that conversation are some important components to encourage men. And also for providers, understanding the cultural factors that influence men behaviors and help-seeking behaviors such as machismo, such as gender roles, and also the role in spirituality. So that all those concepts have to be taken into consideration as we provide services to our communities and especially men.
Gracias, Ruth. I know we only have 4 minutos left, colegas. I'm putting the survey in the chat box. Please open that up and start to give us some feedback. I also wanted to call attention to Armando put in the chat, la cabeza es parte del cuerpo. The head is part of the body. That's so powerful. Y también I wanted to ask from our colega Kim, do you all have the report online that you referenced? And I don't remember if that was for the report that Ruth pulled up or Claire.
I think you asked in the chat for the one with the Claire that
Okay.
pulled up about the RRT services.
We actually don't have any written stuff because we are so little and so small, and at the same time so focused on our community that we have not been able to publish any of our work. You are the first ones hearing about what we have done in this setting. We hope to do something in regards to that. But in our PowerPoint, if you go and check it in our presentation, there are the resources about rapid response services and then resources in regards to what we have done. Oh, and Kim, maybe you're talking about like the COVID-19 farm worker study. Yeah, within the study. Thank you for sharing that. Okay, so I think we can entertain another question, or maybe if you don't have a question, we would like for people to write in their chat or just to share with us, what are you taking today from this presentation? Either type in your chat or turn your microphone and tell us, what are you taking from today's session? No les dé vergüenza. Don't worry about it. Come tell us, what are you taking from today's session, from today's meeting? Okay, it said, nos dice, promotoras are essential. Definitely, community health workers are essential in everything that we do. And therefore, without their partnership, we will not be able to do what we have done so far. Sandra, great information. You're doing great, amazing work. Thank you so much. Thank you for those beautiful words. And Rosario, oh yes, Rosario, tell us.
Lo voy a decir en español, ¿es that okay?
Sí, claro que sí.
Definitivamente yo tomé este curso porque ser promotora, llegar a la comunidad, llevarles nuestras experiencias y poder arrimarlos a que ellos reciban los servicios que necesitan, que tienen demasiadas limitaciones por X cosa. Entonces ser promotora es un rol súper importante y ellos solamente tienen la esperanza en contar con gente que les ayude y que les lleve información de lo que ellos no saben y que necesitan urgentemente.
Gracias Rosario por lo que ha compartido. Y es justamente una de las bases fundamentales, one of the cornerstone of health, una de las bases fundamentales de la salud y de la salud emocional es la comunidad. Y especialmente cuando hablamos de la comunidad va a ser los promotores de salud. Uno como un componente importante. So a cornerstone of healing and health is community. And one way is to get that community and connection with the communities, promotores de salud and community health workers. Gracias,
They
Rosario.
do so much.
Y todos los promotores aquí, every promotor, thank you so much for the work that you do and for helping us reach to the community. And Maribel, the floor, this platform is back to you.